Hello, everyone. Welcome to my channel, where I share useful information about health and wellness. Today, I'm going to talk about heart attacks and stroke, what they are, what are the symptoms, what are the checkups you should do to make sure you will not have a heart attack or stroke in the next 5 years, what to do if you have one, and how to prevent them naturally. If you find this video helpful, please subscribe, share, like and comment below. A heart attack is a serious medical emergency that occurs when the blood supply to your heart is blocked by a blood clot or a buildup of fatty deposits called plaque. This can damage or destroy part of your heart muscle and cause chest pain, shortness of breath, sweating, nausea, and other symptoms. A heart attack and a stroke are both life-threatening conditions that are caused by a sudden cutoff of blood flow, but they affect different organs. A heart attack is caused by a blockage in the heart, while a stroke is caused by a blockage or bleeding in the brain. Some of the common symptoms of a heart attack are chest pain or discomfort that may feel like pressure, tightness, squeezing, or aching in the center or left side of your chest. The pain or discomfort may last more than a few minutes or come and go. Pain or discomfort in other areas of your upper body, such as your shoulder, arm, back, neck, jaw, teeth, or stomach. The pain or discomfort may spread from your chest to these areas or occur without chest pain. Shortness of breath that may occur with or without chest pain. You may feel like you cannot breathe deeply or catch your breath. Other signs that may include breaking out in a cold sweat, feeling nauseous, vomiting, feeling lightheaded, dizzy, or faint. Some of the common symptoms of a stroke are weakness or numbness in one limb or the face. You may have trouble moving your arm, leg, or facial muscles on one side of your body. Trouble speaking or understanding what others are saying. You may have difficulty finding the right words, slurring your speech, or not making sense. Vision problems in one or both eyes. You may have blurred, double, or blackened vision, or lose sight in one eye. Severe headache that comes on suddenly and has no obvious cause. You may also have nausea, vomiting, or drowsiness. If you think you or someone else is having a heart attack or a stroke, you should call for an ambulance immediately and follow the operator's instructions. Do not drive yourself or wait for someone else to drive you. Every minute counts when it comes to saving your heart and brain. The best way to prevent a heart attack and a stroke is to adopt a healthy lifestyle that lowers your risk of developing heart disease and high blood pressure. These are the leading causes of death worldwide, and they can be influenced by factors such as smoking, high cholesterol, diabetes, obesity, stress, and more. What are the checkups you should do to make sure you will not have a heart attack and stroke in the next 5 years? To make sure you are not going to get heart attacks and stroke soon, you should do some regular checkups that can help you monitor and improve your heart health. Some of the checkups you should do are blood pressure test. This test measures the force of your blood against the walls of your arteries. High blood pressure can damage your arteries and increase your risk of heart attack and stroke. You should have your blood pressure checked at least once a year or more often if you have high blood pressure or other risk factors. I posted a video about blood pressure on my channel. You can find the link above. Cholesterol test. This test measures the levels of different types of fats in your blood, such as LDL, bad, cholesterol, HDL, good, cholesterol, and triglycerides. High levels of LDL cholesterol and triglycerides can clog your arteries and cause a heart attack, while low levels of HDL cholesterol can increase your risk of heart disease. You should have your cholesterol checked at least every 5 years or more often if you have high cholesterol or other risk factors. I have uploaded a comprehensive video about cholesterol to my channel. You can find the link above. Blood glucose test. This test measures the amount of sugar in your blood. High blood sugar can damage your blood vessels and nerves and increase your risk of heart disease and diabetes. You should have your blood glucose checked at least every 3 years or more often if you have diabetes or other risk factors. Please, hit like and subscribe before we move on. Electrocardiogram, ECG. This test records the electrical activity of your heart and shows how well it is working. It can detect abnormal heart rhythms, signs of a previous or current heart attack, or problems with your heart valves or muscles. You may need an ECG if you have symptoms of a heart problem, such as chest pain, shortness of breath, or palpitations, or if you have a family history of heart disease. Echocardiogram. This test uses sound waves to create a picture of your heart and show how well it is pumping blood. It can also measure the size and shape of your heart chambers and valves, and detect any defects or damage. You may need an echocardiogram if you have symptoms of a heart problem, such as chest pain, shortness of breath, or swelling in your legs, or if you have a history of heart disease or a heart murmur. Stress test. This test measures how well your heart works under physical stress, such as walking on a treadmill or riding a stationary bike. It can show if your heart gets enough blood and oxygen when it needs it most, and if there are any blockages in your coronary arteries that can cause a heart attack. You may need a stress test if you have symptoms of a heart problem, such as chest pain, shortness of breath, or dizziness during exercise, or if you have a history of heart disease or risk factors. These are some of the checkups that can help you prevent a heart attack. Of course, you should also follow a healthy lifestyle that includes eating well, exercising regularly, quitting smoking, managing stress, and taking medications as prescribed by your doctor. You can also eat some superfoods that can help you prevent heart disease and keep your arteries clear. Some of the foods that can help you prevent heart disease and keep your arteries clear are berries. Berries are rich in antioxidants called flavonoids that can lower your risk of heart attack and stroke by improving blood flow and preventing inflammation. Beans and legumes. Beans and legumes are economical sources of plant-based protein that provide fiber, magnesium, and phytonutrients that can lower blood pressure and cholesterol levels. Tomatoes. Tomatoes are high in lycopene, a powerful antioxidant that can protect your blood vessels from damage and lower your blood pressure. Fish. Fish such as salmon, tuna, sardines, and mackerel are high in omega-3 fatty acids that can lower triglycerides, inflammation, and blood pressure. Omega-3s can also prevent irregular heartbeats that can lead to sudden cardiac death. Oats. Oats are a whole grain source of dietary fiber that can lower your cholesterol and blood sugar levels. Oats can also make you feel full longer and prevent overeating. Leafy greens. Leafy greens such as spinach, kale, collard greens, and lettuce are packed with nutrients, fiber, and antioxidants that can lower your blood pressure and prevent plaque buildup in your arteries. Nuts and seeds. Nuts and seeds such as almonds, walnuts, pistachios, sunflower seeds, and flax seeds are good sources of protein, fiber, unsaturated fats, plant sterols, and minerals that can lower your cholesterol and improve your heart health. Pumpkin. Pumpkin is a versatile vegetable that provides fiber, potassium, vitamin A, and beta-carotene. These nutrients can lower your blood pressure and protect your eyesight. Yogurt. Yogurt is a dairy product that provides calcium, protein, and vitamin D. These nutrients can strengthen your bones and teeth and lower your blood pressure. Yogurt also contains probiotics that can improve your digestion and immunity. Olive oil. Olive oil is a good source of monounsaturated fats, which can help lower cholesterol levels. It is also a good source of antioxidants. Green tea. Green tea contains antioxidants that can help protect your heart health. It is also a good source of caffeine, which can help boost your metabolism. Flaxseed. Flaxseed is a good source of fiber, omega-3 fatty acids, and lignans, which are plant compounds that have been shown to have heart-healthy benefits. Avocado. Avocado is a good source of healthy fats, fiber, and potassium. These are just some of the superfoods that can help you prevent heart attacks naturally. Of course, you should also avoid foods that are high in salt, sugar, saturated fat, trans fat, and cholesterol. These foods can increase your risk of heart disease by raising your blood pressure and clogging your arteries. It can help lower cholesterol levels and improve heart health. You should also exercise regularly, manage your stress levels, quit smoking if you do smoke or avoid secondhand smoke if you don't smoke, limit alcohol intake if you drink or avoid drinking if you don't drink, get enough sleep, check your blood pressure, cholesterol, glucose levels regularly, and follow your doctor's advice if you have any medical conditions or take any medications. There are many exercises that can help prevent heart attacks and strokes. Some of the best include aerobic exercise. Aerobic exercise is any type of exercise that gets your heart rate up and makes you breathe harder. Examples of aerobic exercise include walking, running, swimming, biking, and dancing. Strength training. Strength training helps build muscle and bone mass. This can help protect your heart by improving your circulation and reducing your risk of falls. Examples of strength training exercises include lifting weights, using resistance bands, and doing push-ups and sit-ups. Balance exercises. Balance exercises help improve your coordination and reduce your risk of falls. This is important because falls are a major risk factor for heart attacks and strokes. Examples of balance exercises include Tai Chi, yoga, and standing on one leg. Flexibility exercises. Flexibility exercises help improve your range of motion and reduce your risk of injuries. This is important because injuries can make it difficult to exercise, which can increase your risk of heart attacks and strokes. Examples of flexibility exercises include stretching and yoga. By following these tips, you can improve your heart health and reduce your chances of having a heart attack. I hope you enjoyed this video and learned something new today. If you did, please subscribe, share, like, and comment below. Let me know what other topics you want me to cover in the future. Thank you for watching and stay healthy.